Healthcare in America. It's not broken in the way most people think. The shocking truth is that while we have some of the best doctors and hospitals in the world, nearly 530,000 families still go bankrupt each year trying to access them.
You know what's fascinating about that statistic? Most of those families actually had health insurance when their medical crisis began.
Exactly right. And here's where things get really interesting. When Americans complain about healthcare, they're rarely talking about the quality of medical care. We're actually leading the world in medical research, cancer treatment, and surgical innovations.
So what's the real problem then? Because clearly something isn't working.
Well, imagine having a Ferrari in your driveway. But before you can drive it, you need permission from 3 different companies, have to file paperwork in triplicate, and might still get denied access even in an emergency. That's basically the American healthcare system. World-class care trapped behind a maze of insurance bureaucracy.
That's such a perfect analogy. And it explains why people from other countries often misunderstand American healthcare complaints.
Let me share something that really drives this home. Last year, a friend of mine did everything right. Checked that the hospital was in network before an emergency room visit. Had good insurance through his employer, even called ahead. Then, boom, $7,000 bill because the ER doctor wasn't in his network.
Oh my goodness, how is anyone supposed to verify network status when they're having a medical emergency? That's absolutely absurd.
And here's where it gets even more mind-boggling. Studies show that about 64% of Americans avoid or delay medical care specifically because they're afraid of unexpected costs. Not because they don't trust doctors, but because they don't trust the insurance system.
You know what really gets me about this whole situation? The sheer complexity of it all. Like, you practically need a law degree just to understand your benefits.
Oh yeah, let's talk about that complexity for a minute. You've got deductibles, co-pays, coinsurance, out-of-pocket maximums, in-network versus out-of-network providers. Prior authorizations, it's like trying to do your taxes while running a fever.
And don't forget about the infamous medical necessity determinations. Can you explain why an insurance company can override a doctor's medical opinion?
Well, that's one of the most frustrating parts of the system. Your doctor, who spent years in medical school and actually examined you, can say you need a treatment, but then someone with a checklist at an insurance company can simply say, "Nah, we don't think that's necessary."
That must drive medical professionals absolutely crazy.
It does, and here's a shocking statistic. Doctors spend an average of 20 hours per week just dealing with insurance paperwork. That's time they could be spending with patients.
So what can people actually do to protect themselves in this system? Because it sounds like a nightmare.
Well, there are some strategies that financially savvy people use. First, never trust HR's summary of benefits alone. You need to get the actual summary of benefits and coverage document from the insurer. It's usually 150 to 300 pages long.
That seems excessive.
It is. But here's the key. Before any non-emergency procedure, you need to call your insurance company and ask specific questions. Get the exact CPT codes, confirm if prior authorization is needed, verify if everyone involved is in network, and most importantly, get everything in writing with reference numbers.
I've heard horror stories about people getting surprise bills even after doing all that, though.
That's where the No Surprises Act of 2022 comes in. It's actually made some positive changes. Now, if you go to an in-network hospital or emergency room, they legally can't hit you with out-of-network bills for things like anesthesiologists or radiologists.
That sounds like progress, at least. But why did we need a law for that in the first place?
Because the system wasn't designed with patients in mind. Did you know that medical billing errors occur in up to 80% of hospital bills? That's why another crucial strategy is to never pay a bill without disputing it first.
So, basically, the healthiest people in America aren't necessarily the ones who take the best care of themselves, but the ones who best navigate the paperwork?
Exactly. And here's the most important thing to remember. Medical debt is the #1 cause of bankruptcy in America, affecting people across all income levels. It's not about being poor. It's about being unlucky enough to get sick in the wrong way at the wrong time.
That's a pretty sobering thought for the richest country in the world.
You know what's even more sobering? Studies show that about 68% of Americans are just one major medical event away from financial disaster, even with insurance.
So what's the solution? Other countries seem to manage healthcare without all this complexity.
Well, that's the trillion-dollar question. The irony is that America spends more per capita on healthcare than any other nation. Yet we're the only developed country where medical bankruptcy is even a thing.
That really puts things in perspective, doesn't it?
It does. And until something changes, the best advice we can give is to document everything, question every bill, and never be afraid to fight for your coverage. Because in America, staying healthy isn't just about taking care of your body. It's about being ready to battle bureaucracy too.